A bit technical today, but still informational and experiential. Energy psychology, our topic, combines Eastern approaches with Western psychology for specific areas such as chronic pain, trauma, stress, anxiety, and post-traumatic stress disorder. Also known as cognitive somatic therapy, it is combined of mind-body methods designed to strategically and methodologically, intervene with the human energy systems. Medically referred to as bioenergy, it describes the energetic relationships in human beings linking systems of behavior, thought, emotions, and sensations. It includes various treatment modalities that are used to rewire disturbing events that are trapped, unresolved, and not yet integrated. Empirically evidence-based energy psychology suggests that psychological problems are a reflection of disturbed bioenergetic patterns with communication between a person's neurobiology and their cognitive, behavioral, emotional patterns. Changes in biological, genetic, and neurological markers have all been seen in studies that utilize energy psychology, particularly noting two phases of trauma treatment, which are, first, to calm the nervous system, secondly, to address the root cause of the problem. Bio-social energy imbalances and blockages often follow physical and/or psychic trauma and is directly responsible for occurrences of both somatic, for example, pain and discomfort, and psychological, for example, post-traumatic stress disorder and anxiety symptoms. Energy therapy might be sought out after traditional therapeutic methods have not worked. In addition, clients may seek this type of therapy if it aligns with their religious, cultural, or spiritual needs. Some people may consider energy therapy as an alternative or an adjunct with traditional therapy if they face barriers to treatment and/or are post-traumatic stress resistant. Most energy psychology approaches are brief, active, and structured. Energy psychology modalities can be used as standalone interventions or can be easily integrated into a broader clinical treatment plan. Clients are typically taught self-help techniques so they can use them whenever needed. Sollite Integrative Medicine utilizes comprehensive energy practices in addition to other services. For more detailed information, log on to www.sollite.com. That's Sollite. All right, let's experience what energy might feel like for you. Everybody is unique. Everybody has different subtle sensitivity levels. So just experience what it is for you. I'm going to start with very basic energy technique, which I'm sure most of you are familiar with. You take your two hands and you rub them together really hard, creating friction and heat. And you do that as long as you feel like it, so you can really get it nice and warm. And then just simply stop and pull your hands apart a little. And then try to bring them back together and see if you bounce up against something. Take them a little bit further apart. See if you can feel any kind of magnetic pull or anything radiating through both of your hands. Push them back together again and see if you kind of are coming up against a resistance, like a ball or a wall. Go out as far as you can and see how far you can still feel the energy between your hands. Can you still feel it radiating way out here? When you come in, does it come in all the way here, or can you bounce in and feel the wall way out there? All right, you can practice that on your own and also practice this meditation on your own. This is a very brief meditation, so you can close your eyes and just get a feel of what energy feels like for you, either inside your body or outside, all around. Breathe in, exhale, just relax. Actually, big secret, the more you relax, the more you can feel. Inhale again, exhale, just settle into your body and relax. Let go of any thoughts that might have come to you or situations that you were doing a minute or a second ago, even listening to this lecture. And just be still. Tune in to your senses. We have more senses than our 5 usual, normal human senses, but let's start there with them. Feeling, hearing, smelling, tasting, seeing. Many are versed in tuning in to a variety of those senses, and some are more attuned and keen to 1 or 2 of them, like seeing or hearing. This is very subtle, so be patient with yourself. Have compassion and understanding, and just sit with it for a while. Feel the subtleness. Energy might feel like it's tingling. There might be a temperature change. Definitely there's movement if you can feel it moving around. Feeling sometimes associated with fluid or floating kind of feeling. And opposite sometimes can happen, like a sinking or deepening feeling. Heavy or light, both can appear and change at different times. See if there's one part of possibly a solid energy mass that's calling your attention, which would be a blockage, an energy that's trapped or stuck in your body. Is something like really calling your attention, like vibrating or tingling? On more subtle levels, there's also light and sound. Sound and light would come more into a feeling of frequency and vibration, like something shaking or rattling on a subtle level within. Often, again, you will get images. You will hear things possibly with the sound. So practice this on your own. Discover the way you uniquely feel energy, your own others, and even the world around you, like trees, grass, animals. Enjoy your practice. We will continue. And think of using energy psychology or energy work practices as an alternative or a complementary adjunct to your traditional means of therapy.